having the second session today. At the foundation, we believe in the importance of making connections and facilitating innovative collaborations, making sure we're working to elevate all voices across the state in the community. And that is really why we're proud to join the Rural Center, the Governor's Rural Initiative, Hometown Strong, AHEC, and the Office of Rural Health to facilitate this conversation. And as we work to bring this coalition together, we wanted to keep our mission really simple, and that is to raise awareness about COVID prevention and vaccine deployment in rural North Carolina. But honestly, this is about facilitating a conversation so all of us at the state level and down in the communities on the ground, working with the people who live in your communities, that we can share, we can learn, and we can act together. And so we have two objectives for what we're trying to do with this coalition. And that is, we're going to do our part as statewide organizations to bring you any information that we have, tools, resources that might be helpful for you on the ground. It is up to you and your decision on what you need, but we wanted to make sure we were bringing those resources to you and that you were aware of them. And our second objective is to make sure we're creating a feedback loop. It shouldn't be a one-way conversation. We need to learn from each other. And so that's why it's so important that we bring our community partners to this conversation, but that we also carve out time to have some robust conversation in the chat. So I encourage you to ask questions as we go. Don't leave me hanging as a facilitator. Give me some questions to ask. So with that, let's dive in and get started. I'd like to introduce our three community speakers to you today. I'm so excited to have the panel that we have today. The first speaker that we'll hear from is Jeff Howell. He is with the Emergency Services. He's the Emergency Services Director in Yancey County, and he's going to have some great insights to share around how he has kept his community involved and updated and being very authentic in the way he shares information. And then we're going to be joined by Schell McCall, who is the Executive Director at Aligned Toward Health. And she is going to share with us how she works with Jeff in the community to take the insights that he's sharing and the information he's sharing and really give us some good guidance of what she's doing there in Western North Carolina to support her community. And then finally, we'll hear from Alejandro Pena, and we are so excited to have him. He is with the Latinx Advocacy Team, an interdisciplinary network for COVID-19. This is a Latin-19 group focused on supporting the Latinx community in Durham, Orange, and Chatham County. And this group is doing some really great work that he's going to share with us today. So that is who we have on tap. I'm really excited. So with that, I would like to start with Jeff. Jeff, good morning. There you are.
Yeah, here I am. This was kind of a crazy morning for me. So I literally just sat down and I'm doing this on my cell phone right now. So I'm a little disjointed right now, but
we are thankful that you're here. And what we say on my team is we are constantly working to extend grace to one another because this is a messy time and difficult. So it is totally fine. We're just thankful that you were able to carve out a little bit of time for us. Jeff, I would love to open it up to you and let you tell the group a little bit about you, the work you're doing, and how you've worked to mobilize on the ground there in your community to bring folks together.
Well, first of all, thanks for having me on and giving me this opportunity, and thanks to my semi-partner in crime, Schell, for throwing me under the bus for this thing. She has people like Schell McCall. Everybody needs people like that around them, who's your cheerleader and when necessary your butt kicker. She's a great person, and I'm very, very blessed to be associated with her. Here in Yancey County, we're a small rural county, and I'm so happy that that's the focus of this group. But in big counties, small counties, whatever it is, you're always going to have these core groups of people and people that are truly interested in the things that you're doing. And I mean, to me, what I'm doing with my daily correspondence, I guess, with them, I'm copying and pasting 95% of what I put out. I get daily updates from Mike Sprayberry from North Carolina Emergency Management. And I go through his emails and I look at it and go, this is something that's important to, whether I understand it or not. And the vast majority of the time, I don't understand this stuff. But I know that there's groups out there that will be interested in it and can use that information and passing that information and getting it out there and receiving the information that people send me. Schell sends me stuff all the time. Several other groups send me information, but it's that collaboration that really makes this whole thing work, and just information sharing. When you've got information sharing and you've got interested parties, then you have effective collaboration. Every once in a while, I'll insert my 2 cents worth. Sometimes I get up on my soapbox and I know that I probably shouldn't be doing that, but I'm retired from the military, and I call a spade, and when I see something's messed up, I'm going to say it. It doesn't always work in my favor, but everyone knows exactly where I stand on it. To me, it's just passing information along is so basic, and I really don't think that I'm really not doing anything. I'm kind of stuttering and stammering, but I'm kind of at a loss because it's so simple. It's just when you have information, put it out there for the other people in your group. They can very likely do much more with it than I can. Me keeping it to myself does nothing. I don't get to read the majority of what I send out, but I'll see that it's, might be important for somebody and just pass it along.
Jeff, that's so helpful. And I would love to hear from you, and I would think this would be helpful for the folks on this call. When you think about the pandemic and need to learn in real time and then coordinate in real time, talk a little bit more about the value that you've seen in Yancey County of collaboration and that ability to have real relationships with partners like Schell on the ground. Because I think you said this kind of jokingly, but I think there's a real insight here around, having a partner like Schell and her organization that can be a cheerleader and a butt kicker. I know you laughed when you said in this world that we're in, that to me is a really interesting insight of collaboration and partnership and the real authenticness, if that's that we need to have with one another. Talk a little bit about how that's played out in Yancey County and how you and others in the community have worked to facilitate that.
Well, and I've kind of I really got a head start on this whole thing because I have lived in Yancey, or this is where I was born and raised. I know all these people. I mean, I'm related to them, went to high school with them, used to date them. It's
we need a separate call for that conversation.
I know. I mean, well, sometimes as long as I'm not dating them and related to them, then that's a whole different Appalachian story. But having that relationship for me, it really makes it easy. Because I know who these people are. I know where the needs are in my community. Right. But for the counties where people may be new to the area, getting involved in different groups, doing stuff with PATH, that's a big part. I've never really worked that much with the health department until this pandemic. Quite honestly, I've never really had a reason to. And I've learned a lot about rural health care, and I never knew that HIPAA was such a gigantic thing, but apparently it is. And sometimes, it's there for good reasons, but it'll hamstring you sometimes. The collaboration piece between, and sometimes this works against you in small counties, because it can be, this fire department doesn't want to work with this fire department. You get into the turf wars, and sometimes that can kind of hamstring you a little bit.
Right. Absolutely. And I'd love for those on the call, as you hear Jeff describe some of these, particularly the point he just made around, I had never worked with the health department before this pandemic. Share if folks have insights or thoughts that they've experienced in, seeing the coordination between health departments, emergency management services, community-based organizations during this pandemic. Love for you to share some insights in the chat box as we continue the conversation. I think you're hitting on some really good insights, Jeff, that, we're all learning as we navigate through this. If you don't mind, Jeff, let me go to your partner in crime.
Sure.
and talk a little to Schell over here. And as I mentioned before, Schell is with the Partners Aligned Towards Health organization. And Schell, I'd love for you to introduce yourself to the organization and share a little bit about your group and what you're doing and some of the things that you've been experiencing on the ground through this pandemic.
Sure. Thank you, Kelly, and thank you everyone for having me today and being interested in what we're doing. So as Kelly said, I'm the executive director of Partners Aligned Toward Health. We're a 501c3 nonprofit serving Yancey and Mitchell counties in Western North Carolina. And our whole organizational focus for 20 plus years has been responding to community health needs as identified by the community. So that happens formally with community health assessments, and it happens informally with known partners in the community and showing up in multiple spaces and being a bridge for information and identifying things. And I said to somebody recently, if we stuck to just the community health assessments as our guide, then we wouldn't be responding to COVID right now because of the cycle of that. So I think there's a really important aspect of being able to be nimble. We're our own entity. We work very closely with health departments, with Jeff Howell, with Parks and Rec, with the Economic Development Commission, with the county governments, but we're not a state or federal agency. And so we can be a little bit more nimble at times than some others. Being an organization that responds to health needs of the community as soon as COVID started to hit, it was kind of obvious that we needed to respond and unclear how best to do that. And I have to give full credit to Jeff because I really think that through this pandemic since March, part of the challenge has been the unknown and not knowing what's coming, not being clear what's resources are available, who's doing what. So I think that Jeff being the hub of really collecting information in the community from the health department, from our federally qualified health centers, from our child care centers, from our school system and what they're doing to serve students, and then sort of compiling that all in a digest and just saying, here's what we know. We don't have all the answers, but here's what we know in this moment. And here's a resource if you're interested in one thing or another. We've partnered with Jeff also to distribute masks, to a lot of different folks. We realized, I think Jeff and I were both in a meeting early on, late March, where we realized that Yancey County, we wanted the ability to actually have some funds to be more flexible with. And so we got together with a bunch of other organizations and started a COVID relief grant fund for our community that's held by another nonprofit in our community. But that was important too, so that we could say, oh, our food pantry is running really low. Right. We could fundraise in a way that we could direct, funds where people could know. I think that's one of the things is like, what can I do for my own community?
Mhm.
We work with a lot of partners. We pull, as I mentioned, economic development, we pull in law enforcement, we pull in healthcare. Everybody has a different perspective, and I think everybody is pretty overwhelmed and overworked now. And so wherever we can work to sort of maximize the impact or share information, we're trying to just make sure as many people in our information in our community we're working with the same information and sharing that. And another thing we've done is working also with Jeff, we realized early on that the information that was out there that was available in Spanish was more targeted to migrant farm workers. This was early in the pandemic. This is not the case anymore, but that's not our Hispanic community for the most part. And so we've also developed a lay community ambassador program where we're working with bilingual, bicultural community members and providing them really high level information about COVID, about vaccines, about best practices, about how to talk to your neighbors when things are hard, and leaning on them to be the funnel of information into their community. And in the meantime, we've been able to establish some really great connections between partners and some new trusting relationships. So that's been really, really great as well.
I was feverishly writing because it was full of really good nuggets to pull to talk with the group on. I think where I'll start is your point around, you made two really interesting points that I think for the group, it's worth everyone thinking about. The first is this need to be nimble. And so I'd love for folks to, if you want in the chat, to share other ways in your community that you found the ability to be nimble in this time. And Schell, I'd love to hear a little bit more on the second point, which is the value of creating this hub model, and how I'm really curious around how you guys work to bring in different communities, with Jeff serving in the hub as the hub, how you work to bring in other organizations to ensure they knew about it, to get engagement, like how more of an organic thing that continues to happen, or how have you facilitated that on and on to lead to your point around the ability to have new relationships that are quite fruitful, it sounds like?
We have an advantage in that our organization already coordinates community collaboration around. Mm-hmm. And so we had existing relationships within that network. And I've been really intentional about connecting with other groups in the community and saying, hey, sharing this information, are you interested in being a part of these email chains? Would you be willing then to pass this information through? And so it's not just going in, a lot of the information being shared right now is via email. And so it's not just landing in somebody's inbox and dying. We're actually being intentional about asking people to distribute that information into their networks. And, as Jeff said, we know a lot of these people. So a lot of times it's, I've called up the director of the health department and said, I know you're slammed. I'm getting a lot of these questions. Like, can you just provide a quick hit that I can get out? Because I know you don't have time to do it.
Right.
That Jeff is doing too. Like when we hear that there's a big question or a big unknown in the community, picking up the phone and asking people,
mm-hmm. Yeah.
And offering to share that. And Jeff's email, for those of y'all who don't know, and Jeff, please clarify this. I think, Jeff's target originally was all of the department heads in the county, all the municipal heads, and then many nonprofits, key stakeholders, RFQHC and stuff like that. But then it gets shared beyond that because a lot of those people are key in their churches, are key in their other communities, and then they're sharing that information from that point. And so I'm seeing Dale's question about making sure that information is accurate.
Yep.
I think, one of the things that Jeff did really, really early on, he convened a meeting with our health department and just said, this was very early. These are the places to go for trusted information: the CDC, North Carolina DHHS, North Carolina Emergency Management. And then only sharing information that can be verified. If we're sharing information from the health department, verifying that that's accurate from our FQHCs, those kinds of things. So I don't know if that fully answered your question, but we're not just sharing the information, but we're being really explicit about asking others to share it within their networks as well.
And this is so interesting and helpful, particularly as we continue to push prevention measures, how to prevent the spread of COVID through social distancing, mask wearing, all of those important pieces, but also beginning to transition into the vaccine space and all of those challenges that I know you have faced up there. And so I'm really interested to hear a little bit more from you around this notion. I loved what you said about we created this lay community ambassador program, which I think really gets to that point around trust, right? How to build those trusted ambassadors in the community to help with education. So talk a little bit about how you went about that program to overcome some of those trust barriers, to engage the right people to help target the populations that you needed to reach.
Yeah, so it is based off of, what we're doing is based off of an evidence-based model called camp translation, which is, the general knowledge is that it takes about to 17 years for medical discoveries to become commonly known by people in the community. And this is a method that has been established and has been proven to be effective in getting information out into communities faster. And so I've had some experience with that prior to COVID and the pandemic, working with getting information out about long-acting reversible contraception. So it was a method that we were familiar with and that some members of our community were familiar with. And we just kind of targeted, like, what do we know we need information about? We know we need medical information about COVID. We know we need information from emergency management about what's happening in the community. As vaccines developed, we knew we needed information about vaccines. We knew that we wanted to arm, these are just general community members. They're not necessarily professionals. So we provided them with information about effective health messaging. And what we did is we just targeted folks that we knew were experts in these fields and asked them to come in and share. One of the key things to the success of our program, I think, is that it's a two-way street. It's a non-hierarchical project. And so we're respecting our ambassadors and paying for their time as subject matter experts, because they're providing us feedback of what they're seeing in the community, of what their community needs. And it's been really revealing, I think, in terms of a two-way street of information. And now they know if they have a question and Jeff Howell has the answer, probably they know to go to him. And so it's been a process of what do we know we need to share? And then asking our ambassadors, what have we not shared that you need to know? And then it's been on us as key stakeholders to kind of find the people that provide that information in a trusted way. And then asking the ambassadors to help us create messaging that reach their community.
That is so helpful. And I love your point about non-hierarchical and a two-way street of information. I think that's a really important nugget for all of us to remember and keep in mind at all levels across the state. Let me move to our good friend. Thank you, Schell, for that. We'll come back and for some Q&A in a few minutes, but let me move to our good friend, Alejandro. Good morning, Alejandro. As I mentioned, for those who just joined a few minutes ago, Alejandro is with the Latinx advocacy team, an interdisciplinary network for COVID-19. And his group has been working to really support the Latinx community in Durham, Orange, and Chatham County. And I know, Alejandro, you have lots going on, including, I think, something last night related to vaccines. So would love for you to introduce yourself to the group and share a little bit about the Latinx 19 group and the work that you've been doing through the pandemic.
Sure. Thank you, Kelly. Nice to see you all today. Yes, Latin 19 started, it's an initiative that started in March 2020. A group of 12 people gathered with the leadership of 2 Duke Health clinicians, Viviana Martinez Bianchi and Gabriela Maradiaga. And that small group grew a lot during the almost 10 months now. Now we have around 560 participants join us in our weekly meetings. We had met weekly non-stop since then. And it's a cross-sectoral group with a big umbrella, which is health equity. But since we started, we are 100% focused on COVID-19. First of all, to put because the Latina community, as we call it, because there are so many terms to use, Latinx, but we chose Latina community. At the peak of the pandemic, we were representing like 75% of the people infected in the region for the type of jobs that we do and many other reasons. And this has, because of a lot of efforts from the community that has gathered together in this coalition of organizations. I'm talking about 80 something organizations, members that are members of this coalition, 550 people that regularly join. We have an average in every weekly meeting of 90 people joining us. We have guest speakers from all different sectors, the academia, the public sector, a lot of grassroots organizations. And the beauty of it is that many of these organizations that were working like in silos before the pandemic have joined forces, and synergies happen. They pop up like mushroom in every meeting. And the event you mentioned, Kelly, right now, that took place last night is a good example of that. We pull up this event in 5 days. All the Duke Health provided 150 vaccines, and different members of the community helped in all the different ways that they could help. And we had a very successful vaccination day. It's a pilot project. I will go in more detail about this a little later, but going back to what we do, what Latin 19 works for, what was highlighted by Jeff and Schell about the importance of information sharing. I want to adhere that information was kept among the Latinx community. Just before that, it could be a good idea to give you a sense of the percentage of what the Latin community represents. At state level, we are around North Carolina, 18% of the population is Latinx. In Durham, 14%. And from that 75% of people infected with COVID, we went down to, now it's an average of 24% of Latinx are infected. But it's still high. And when it comes to vaccines, the inequity is particularly clear. The inequity in the system is reflected in the way vaccines are distributed, and it's a big concern from governmental authorities, from Duke Health, of course, and the rest of the community, with the leadership of many different community-based organizations that are raising their voices and getting together in Latin 19. Only 2% of the vaccines that have been applied went to the Latina community. So we are tackling that specific need, and that's why we organized this event last night. I'm going to share in the chat 2 things.
Great.
Let's see.
That's wonderful, Alejandro. And while you do that, I would, I'm looking at a comment that Sue Collier posted, just reinforcing the point about how critical it is, this notion of partnerships at the patient and community member level, and how that helps foster trust. And that I think is a theme that we're hearing. Sue, I don't know if you want to add anything to that, but I think hearing this point about likely partnerships, the importance of coming together, and how that is going to work over the long term. Sue, did you want to add something to that? And then we'll go back to Alejandro.
I think the only thing I would add is that as we listen to Jeff and Schell and Alejandro talk about all the different layers of communication and interactions and relationships, that it's important that we recognize this has to happen at all levels. It happens at the organization level, where Jeff and Schell were talking about how much effort was being spent collaborating, sharing information, coordinating. And then as we get to what I call the grassroots, the sharp level, where we're dealing directly with individuals and with lay individuals and with informal leaders at the local level, just sitting at a table and giving COVID vaccines to a diverse group of community members, reinforcing all these groups are working together. We're here for you. It's not just this group or that group, but we are all in this together. It matters, and it accelerates, I believe, not only the distribution and the vaccination and the sharing of information, but it also accelerates getting people involved to deal with what Alejandro just mentioned, and that's still the inequities.
Right.
Just something real quick example, a woman that was at the table this past week said that her friends, she was a woman of color, said her friends told her not to come. This is not safe. You should not have this. And she said, and I decided not to listen to people. And so we had a very, personal conversation about what she could do to go back to her community, to her home, to her friends, and share information that would help them make that decision. So
that's helpful. Thank you, Sue, for sharing. That's really helpful. Alejandro, let me go back to you because I know you've shared some resources here. Would you like to tell the group
Yes.
what you shared here?
The first set of resources, the first 2 links are, you have access there to fresh short videos and pictures that we took last night from this event, the Latin 19 vaccination days. This is a pilot project. It was very successful. So we already have been offered more opportunities to do so in this location, which was the Cooperativa Latina, and other locations too, because that's another critical element of this formula, because testing and vaccination needs to happen where the vulnerable community lives. And the centers nowadays are they're far from where the Latina community lives. So that's been taken care of through this kind of events. And that's one of the things we're doing. And the other link that you see is from a Latino newspaper
Mhm.
that already published that. There will be more. There was a lot of press there, so there will be more coming up. But this is very fresh. It happened last night.
That's
The
great.
other link that I sent you is our new website. And through the website, you can access our Twitter and Facebook accounts. We're doing Facebook Live of the different events we do, the weekly meetings, for example. The weekly meetings also have simultaneous interpretation to Spanish.
That's great.
And the third set of links that I sent was today, and as every Wednesday at noon, we have our weekly meeting. Everybody's invited. If you want to join us and see the kind of information it's very useful information because it's clinical from one side, and it's community concerns. We not only raise concerns but bring solutions, and we put together teams, cross-sectoral teams, to tackle these concerns.
Yep.
So it's a very active meeting. It's not just the sharing of information.
That is so helpful. And I think one of the things that I'm so excited about this coalition is the ability to hear from folks like Alejandro and share these resources with all of you. It's truly about creating a dialogue. If these resources are helpful, please take Alejandro up on his offer to share more, join the meetings. I know, and in my experience working with Alejandro, he'll be more than happy to connect with you and share. And then we'd love to hear through this coalition how all of that is working for your community. And so I hope that conversation continues to happen.
I would like
ahead,
to add something, Kelly.
Okay.
We're really happy of being part of RAC. We're looking forward because the tree doesn't allow
Yes.
us to see the forest.
Right.
So sometimes our efforts to increase our reach out to what we have here in North Carolina, it's slow, but it's ongoing, and we want to connect more with all the organizations member of RAC. We love the idea of being part of a network of networks, and we're looking for the best way to have our own dashboard. Yep. With the tools and methodologies you're offering.
Well, let me just highlight what Alejandro is mentioning so everyone has context on the call. Alejandro is referring to an effort, a national effort around Resilience Communities of America. And the whole idea around when you hear the phrase RAC is how do we focus on building resilient communities as we continue to navigate through this pandemic and then after, so that we are addressing the long-term issues that we have seen and that this pandemic has highlighted into the future. And so there's a series of tools that are provided that Alejandro is mentioning. And Marnie, if you can repaste the link to our landing page, in addition to information about the RAC, you'll also see on this landing page just a whole list of outstanding tools, DHHS and others, NC Care 360, that are available to you. And as we get more resources in from organizations, we will continue to post these resources there. So bookmark that landing page and know that we will update it regularly. And if there's anything on that you see that you have questions about, reach out to us and we will set up a conversation and connect you with the right folks to get more information. So with that, we have about 20 minutes left and we have a great group on this call. I would love to open it up for some questions. Feel free to post. You have some amazing resources here on this call. Feel free to post any question that you might have and I'll bring it to the group. But to get us started, I thought I would go back, Schell, if you don't mind me coming back to you, to a point that you made, and I think it's something that I continue to hear in all of my conversations with community-based organizations around. You made a point to say that we decided early on that, and I think it's at the core of who your organization is, if I understand you correctly, but early on that to respond to the community health needs, it has to be based in the feedback from the community, right? And not a top-down approach of telling folks what they need to do. It needs to be a facilitation of listening and being able to use the word nimble and comfortable making adjustments and building these collaborations. I would love to hear from you as an executive director of your organization, how you live into that mindset really on a daily basis of constantly infusing ideas and feedback by listening and being humble enough to recognize where those needs are. Can you share a little bit more about that philosophy and how you approach it?
Sure. It's less of a philosophy and more just like living in small community, I think. I mean, we kind of take a position, and I do, of like, it's my responsibility to show up in spaces where conversations are happening rather than expect people to come to me. And so I'm involved, and Jeff is as well, and a lot of people are, in a lot of different groups that may be directly related to my work or peripherally related to my work. And I'm not gonna lie, it can get a little bit, time consuming. But trying to show up and listen and create bridges and hear the threads from this group is expressing a need here, and I'm hearing something similar from another group. And outreach to other people who have access to community members to say, this is what I'm hearing. Are you hearing the same thing? Are you having these conversations as well? And so I think a lot of it is just like making it a priority to show up in spaces and in conversations that are happening outside of where we're directly working.
Absolutely. And I love your point about taking a time to validate what you're hearing with other organizations. And then I think that's a really important point. We just had a comment posted in the chat from Danielle Brown, hashtag health over profit campaign. This is a statewide issue. Danielle, I don't know if there's anything you want to add to that. We are open to any and all conversations and feedback. And I know that my partners at the Office of Rural Health have really emphasized that they're eager to hear feedback and share. And that is something that our organization in the Rural Center and Hometown Strong are eager to facilitate. So
Good morning. Hi,
Good
my name is
morning.
Danielle Brown. I'm with Black Voters Matter here in the state of North Carolina. We have partners across the state, most of them in rural areas. A lot of the issues that we're hearing and seeing, especially within the Black community, is resources not getting there or folks not knowing about it. One of the things that has been reported is they're saying in our areas that Black people don't want the vaccine. Not necessarily true. What it is a lot of it is educational resources and folks not knowing that it's there. And when they find out that it's there, it's like too late. So one of the things that we are demanding of Mandy Cohen and her group is to ensure that vaccines, education, and resources are getting to where they need to go. The buck can't just stop at certain places and us continuing to point fingers. We need actual results. So what we're doing right now in partnership with one of our partners is just flooding her inbox with letters. And all it takes is just you guys clicking, it said send letter, that's it. And flooding that so that we can get these resources where they need to go. Most of North Carolina is considered a rural area. So when we talk about rural areas, it's not just affecting one or two, it's affecting quite a few people. And when we're also talking about this, we're also talking about folks that may not necessarily even have transportation to get where they need to go as well. So there's a lot of layers, a lot of issues that we're finding, but this has been one of the ones that has definitely been elevated. And one of our partners said, hey, we want to just flood letters right now. This is what we want to do in order to bring some type of attention to this. So I am grateful for this coalition. I'm so grateful to see each and every one of you, really excited to hear all of the work that's going on across the state and the work that's being done overall. But we have a lot more work to do and a lot more places that we need to dig into. So this is one of our ways that we're doing that. We've got a couple of other ways that we're working on as well, but really excited to launch this and to really get everybody to sign on. Thank you so much for this opportunity.
Danielle, thank you so much for being willing to participate and speak. I appreciate it as a facilitator, so thank you. One thing I would say, and I appreciate you sharing all of that perspective, one question I would ask you is, one of the objectives and goals of this coalition is a two-way conversation, right? Making sure that we hear the feedback you just shared, acknowledge it and really take it to heart and elevate that feedback up, but also as statewide organizations, make sure we're playing a role to get you what you need where we can. So I would love to hear your feedback, and we can do this offline too if you prefer, but where this coalition could support your organization with educational materials. Happy to go through any of those resources with you if that's helpful. And Marnie can share the link again for all of that. So any way that we can support your organization with our resources and tools, happy to do so.
Absolutely. Thank you so very much. And we have, like I said, over 30 partners across the state that's digging deep into getting these resources out to these communities that may not necessarily get them on a regular basis.
Right.
We also have We Matter campaign that we're doing right now, because we as Black Voters Matter, when people look at us, they're like, oh, you guys just deal with voting, that's it. No, we deal with the holistic person overall, because I need everybody on this call and everybody in these communities to be alive to be able to go to the polls in November. So that being said, it's taking all of us to do all of this work across the board. And so what we're doing is in April, we're actually going to do a whole 21 county listening session, just digging into these communities and talking to people. We don't want to hear from, I know I can talk, and I'm an activist, so I know I can talk. So we don't want to hear from our activists. We don't want to hear from our politicians. We want to take this time to listen to what our actual communities are needing, and so that we know how we can support them. And in doing that work, it's really, really important that we take that opportunity to say, hey, look, what is it that we need? And part of the issue that we've already addressed and already said overall is COVID-19 information, resources, and vaccines in these areas. So happy to send all that information to you guys. Happy to receive any information that you can give us that we can disseminate accordingly. Thank you.
Thank you, Danielle. And, I think I really appreciate it, Danielle. Thank you for sharing. I think we continue to hear this theme, and that was my question to Schell about listening. And I think there's this level of being humble and making sure that we are open to hearing directly from the communities, what they need, where there are challenges. Would love to hear others' thoughts on that point. If there are any. I'd love to go back to Jeff briefly, Jeff, if you don't mind. We've talked a lot about your ability to pull information together, even you acknowledging it may be a little messy, but just wanting to get feedback out. Talk a little bit about this daily digest email. And I think there's an interesting theme here where being okay with it being as simple as an email of coordinating resources and getting it out there, and not feeling like it has to be something fancy and designed, like at the basic, just getting something out to organizations. Talk a little bit about that and how that is worked.
Well, and that's one of the biggest positives to having this collaboration is, you got a guy like me. I'm pretty simple. I'm pretty basic. Getting that information into the hands of people that can really do something with it, and there's different parts of what's put out. It appeals to different groups, and they can go in there and they can take their piece of it and run with it. Schell can take her piece of it, run with it, or share it amongst their groups. And one of the challenges, particularly up here in the mountains and with the older folks, they, the internet's not a thing for them.
Right.
And so as much good information as we're putting out there, we got to be real careful not to rely so heavily on technology, and get out, get into the communities and make these things known, whether it's through the local fire departments. A lot of times churches, Schell mentioned that, we're very plugged in with the faith community. But using those networks to reach the people that, technology is more of a nuisance than a convenience.
Mm-hmm. Absolutely. And, one of the things during our session last week, we heard from Reverend Galliard in Rocky Mount, and we focused a lot on the benefits of the faith communities and making sure that the faith communities are engaged. I'd love to hear from our panel around how you have worked to ensure the faith communities are at the table and leveraging their standing in the communities to support you.
Well, I'll speak just real quickly on Yancey County. It's such a small community. As like Schell said, everybody knows everybody, and you can't swing a dead cat without, two churches. Somehow or another, everybody is connected somehow. And for the most part, people, you have some people that are very hesitant about the vaccine or anything to do with the COVID situation. But for the most part, people are very receptive. Two of our largest vaccination sites that we've identified are at the larger churches. We just don't have here in Yancey County, we don't have these massive facilities. And it's, there's been absolutely no hesitation. The pastors, the deacons, whoever have openly said, hey, whatever you need, you let us know and it's yours. And that's, that really helps us out a lot. Not everybody has that luxury, but we do.
Right. Oh, Alejandro?
Yeah. Faith communities are key because trust is essential in all this process, in everything we do, having the trust of the community, even vaccination. We have a lot of people that still have distrust of the vaccine. There's a lot of myths going around. So pastors and all community faith leaders have the trust of the community. So they are fantastic people to send messages to those that have questions. We have gone to different churches and to address those concerns, to questions and answers sessions from the doctors in our executive team. We are constantly collaborating with faith community leaders because they participate in our meetings and they are fantastic communicators and excellent people to build trust.
That's great, Alejandro. Thank you both for sharing. And I would just call out to everyone on the call. We continue to have Caroline Collier has posted some really great resources in the chat box from DHHS and NCDOT. So please make sure to check those out. We have one last question here. What is the most effective way to dispel myths among the community? What have you done to address? And I think we've touched on that a little bit. Does anybody have anything else to add around that? Michelle, go ahead.
Yeah, we're doing a PR campaign, newspaper and social media, of highlighting local folks that are known and recognized in the community with their reasons for wearing a mask, is where we started. And now it's like their reasons for getting a vaccine. And we're instilling it with a sense of curiosity and an invitation for people to ask questions. And one of the things that we're doing with our Community Ambassador Real Equality Project is having them do a social media fact or fiction, easy, kind of quick, did you know this? And just sort of trying to engage people in the community without being judgmental, but saying, you know, here are local stories. We're open to your questions about what our experiences have been, and open to the conversations about, nobody's looking forward to that second dose and feeling really bad, but it's going to pass, you know, trying to stay in conversation with people, I think, is just a really good way to approach that.
That is so helpful. I know I have a 13-year-old who is petrified about getting the vaccine, and I try to tell him, you're not even approved to get the vaccine yet. Stop worrying about the needle. But you're right. It only lasts for a minute. We have to get it. This has been a wonderful, wonderful conversation. I want to thank our 3 speakers for your willingness to share, to go deep with us. Thank you for all you're doing in your rural communities. I see here that Sheila in the chat has asked us to send the links to all of what we've shared. Sheila, we will absolutely do that. Marnie, can you start sharing some of that? That would be wonderful. Please go to 2 things, the website, and you can get all of our resources. We've set up a landing page. The link is here in the chat. We also have a feedback survey. We'd love for you to take it. The link is also here. Give us some thoughts, anything we can do to improve. What do you need? This is all about a 2-way conversation. We will have our next session. We will share with you the information. If anyone on the call would love to volunteer to go in the hot seat as a community leader and share what you're doing, please reach out. Carla, if you can post your email address, you can ping Carla and she will get you on the agenda. We would really welcome that. And I know I speak for my friends at the Rural Center, AHEC, Hometown Strong, and the Office of Rural Health, that we really thank you for carving out some time and your willingness to share with all of us. So we look forward to seeing you again soon. And I hope everyone has a wonderful rest of the week. Thank you to our speakers. Thanks so much, everyone.
Thanks, Kelly.
Thanks, everybody.
Thank you all.
Okay.
Bye-bye.